Hey everyone, let's jump right into this explainer. Today, we're uncovering a medical mystery that is literally hiding in plain sight. Seriously, it's probably sitting in your medicine cabinet right now. You reach in, grab a pill you've taken for years, and just kind of assume it's completely safe, right? Well, we're going to unpack exactly why that assumption could be surprisingly risky, especially for seniors, and how a super common habit might actually be silently affecting your most vital organs.
Section 1. The Medicine Cabinet Mystery.
Let's start by looking closely at those everyday NSAIDs, stuff like ibuprofen and naproxen. The pills we casually grab the second we feel an ache or a pain. And honestly, it makes total sense that we do. As we get older, everyday aches are just part of the deal. Maybe it's a bit of arthritis acting up in your knees, some stiffness in your back, or just sore muscles after a busy day. So, millions of us turn to these common pain medications for quick relief. They're everywhere, you don't need a prescription, and because we're so used to seeing them, it's really easy to just assume that over-the-counter basically means 100% risk-free. But heart specialists and surgeons, they are actually sounding the alarm here. They're warning us that for folks over 60, these seemingly harmless little pills can carry some pretty serious hidden risks.
Now, the tricky part is that the warning signs of these hidden risks are rarely obvious. In fact, they're usually just brushed off as getting older. For example, maybe you notice your ankles are a little swollen at the end of the day, or you get a mild shortness of breath walking up the stairs. Or maybe your blood pressure has been slowly creeping up. A lot of people experience these exact things and just think, well, that's the natural march of time. But actually, what you might be feeling isn't just aging at all. It could literally be a direct side effect of that medication you've been taking.
Section 2. Heart under extra pressure. So how do these familiar pills secretly mess with your cardiovascular system? Well, in a normal, healthy state, your body does a great job keeping things balanced. But when you take these specific medications frequently, they can actually throw that balance totally out of whack. Instead of keeping things level, the meds can cause your body to hold on to way more fluid and sodium than it should. Simply put, it makes your body stubbornly trap excess water. And here's why that matters. When your body holds on to all that extra water, the actual volume of fluid in your system goes up. That means your heart has to work much, much harder just to pump blood around your body. Now, for a healthy younger person, this might not cause much of a blip. But for seniors, especially those who are already managing heart disease or heart failure, this sudden extra workload becomes a really serious, unexpected medical concern. It puts an incredible amount of stress on the cardiovascular system. To put that into perspective, this extra stress can totally sabotage your daily health management. I mean, think about it. Many older adults work so hard to keep their blood pressure under control, right? You might be taking your prescribed meds perfectly, eating right, staying active, but still deeply struggling with high blood pressure. And the culprit? This hidden interference. You could be doing absolutely everything right, but still not seeing good readings because a pain reliever you thought was harmless is quietly fighting against your prescription meds behind the scenes.
Section 3. Kidneys and the hose effect.
The plot thickens, though, because the physical effects of these over-the-counter drugs don't just stop at the heart. They also put a massive strain on your kidneys. Imagine a standard garden hose watering a plant. If you reach down and pinch that hose halfway, a lot less water gets through, right? Well, that is exactly what happens to the vital blood flow reaching your kidneys when you take these pain medications frequently. The medication effectively squeezes the hose, restricting the blood flow that your kidneys desperately need to regulate fluids, filter out waste, and support healthy blood pressure.
Since our natural kidney function naturally slows down a bit as we get older anyway, this restricted blood flow becomes a huge problem for long-term health. Over time, frequently squeezing that hose seriously increases the risk of kidney damage. And this is a major red flag for seniors who are already living with diabetes, high blood pressure, or any pre-existing kidney conditions.
Section 4. The Dangerous Medication Blind Spot.
Okay, now let's talk about the twist in this mystery. A massive communication gap happening in doctors' offices literally every single day. When a doctor sits down and asks, "What medications are you taking?" seniors are usually great at meticulously listing out their daily prescriptions, but they almost always forget to mention the over-the-counter pain relievers they casually picked up at the pharmacy. To you, it's just a familiar bottle from the grocery store, right? It doesn't feel like a real medication. But to your doctor, who needs the full picture to treat you safely, it's a massive missing piece of the puzzle.
This communication blind spot is a big deal. It means your healthcare provider just can't see the full picture of what's going into your body. Lots of older adults take some highly specific daily meds, maybe for cholesterol, diabetes, heart rhythms, or blood thinners. Throwing an over-the-counter pain reliever into that precise chemical mix without your doctor knowing is incredibly dangerous. It often leads to unwanted medication interactions, which can skyrocket your risk of internal bleeding or put terrible additional strain on your kidneys. A pill that's perfectly safe for your neighbor might be entirely wrong for you.
Section 5. Safer pain relief strategies.
Now, the good news here is that you don't have to live in fear of your medicine cabinet. By following a few simple, vital steps, you can take back control and completely remove that blind spot for your doctor. First up, never, ever assume over-the-counter automatically means it's safe for unlimited use. Second, always read those labels carefully and follow the dosing instructions to the letter. Third, if you find yourself needing pain medication all the time, you really need to bring that up with your doctor. Persistent pain usually has an underlying cause that actually needs medical attention, not just a Band-Aid. And finally, step 4, keep an updated physical list of every single medication, vitamin, and supplement you take and bring it with you to every doctor's appointment.
And, beyond just reaching for a pill, there is a whole world of safer alternative pain management approaches you can discuss with your doctor. Think about things like gentle daily exercise, physical therapy, starting a dedicated stretching routine, managing your weight, or even just soothing heat therapy. These are fantastic alternatives that can help you actively manage those daily aches and pains with far, far fewer risks to your vital organs.
Now, as always in this explainer, please remember that all the stuff we're talking about is strictly for educational purposes. Your doctor is your #1 partner in your health journey. Never use this as a substitute for professional medical advice, and absolutely make sure you consult your healthcare provider before making any changes at all to your diet, your exercise routine, or your current medications.
But I want you to remember this vital concept. Knowledge gives you the power to ask better questions. The goal today wasn't to scare you away from treatment or tell you to just grit your teeth and suffer through the pain. Honestly, many over-the-counter drugs provide tremendous, wonderful benefits when they're used correctly. The real goal was to equip you with the facts, because when you understand both the benefits and the hidden risks, you can make safe, highly informed choices that protect your heart, your kidneys, and most importantly, your long-term independence.
So, as we wrap up this explainer, I want to leave you with something to think about. Have you ever been genuinely surprised by a medication's side effect, or maybe caught off guard by a warning label you just didn't expect to see? Let us know down in the comments below. Share your unique experiences with us, and hey, don't forget to like and subscribe so we can see you in the very next explainer. Stay informed, stay healthy, and keep asking those great questions.